Hello, this is Dr. Stanley Lang. Welcome to this video. The topic is when fibromyalgia is Lyme disease. So first of all, we might want to talk about what fibromyalgia is before we talk about how Lyme disease masquerades as it. Fibromyalgia was a diagnosis that didn't exist before 1980. It was basically a slowly evolving collection of symptoms that largely were pain symptoms, although some people thought that brain fog was part of the picture. And for about a decade, there was a lot of disagreement amongst physicians about whether fibromyalgia was a real condition or whether it was just a psychosomatic illness that people had. But people with fibromyalgia typically had tender areas in particular areas that were called trigger points, in addition to the brain fog symptoms that I just mentioned. And what happened was that a lot of searching went into trying to figure out why it developed. There's a lot of mystery as to why it developed. And most of the time, a true cause was never found. Now, some of the treatments that have developed for fibromyalgia have been somewhat effective, but most of the time people really don't get good relief for the majority of their symptoms, and they end up living lives having lots of pain, and they have a lot of fatigue, and they have a lot of brain fog. Well, enter the whole question of Lyme disease, and now some folks who are really good researchers are drawing the connection between the two, and some of these doctors do believe that much of fibromyalgia is actually caused by Lyme disease infection. So what is Lyme disease? Well, it's an infection caused by a germ that is transmitted, we thought, only by tick bites. Now, there are some people that believe that different organisms besides the deer tick transmits Lyme disease. I'm not here to debate that issue, but just to say that the known and widely believed vector for the Lyme disease bug getting into people is through a deer tick bite. Now, when this happens, the deer tick is actually feeding on a person's blood supply, and that gives a chance for the invasion of the bacteria. These bacteria are shaped like corkscrews, so they're called spirochetes. Now, in the body, they can change into different forms, which I'm also not going to get into in this video. But the point is, it's a very sneaky infection, and there's a lot more incidence of Lyme disease than is officially diagnosed, because in the United States, the blood test for Lyme disease is notoriously inaccurate. So for many years, I've been seeing patients that fit a lot of the symptoms of Lyme disease. Their blood test is negative, and where do they go for help? Well, in many cases, they go nowhere for help. But a few years ago, I started offering antibiotic therapy as a trial of treatment to see if there would be significant improvement. And if I saw significant improvement within 3 weeks of the trial, then that was justification to continue treatment. So a while ago, I started recommending this approach for some people with fibromyalgia. And I just want to tell you about a patient that I saw recently. It was probably the worst case of fibromyalgia that I've seen in probably 20 years. And this person literally has so much pain that he doesn't even hardly move when he wakes up in the morning for about 3 hours. It takes him about that long to get out of bed. And then slowly the pain starts to go away. Now, I think you would agree that that's a pretty bad situation to have to live with every day. So we started this gentleman, even though his blood test was negative, on treatment for Lyme disease. And he did have some improvement, but he didn't want to take the antibiotic long term if he didn't have to. So I transitioned him over to our natural Lyme disease program, and he had additional significant improvement and is still improving. Now, he's not all better yet, but he's enough better that I'm pretty sure we're on the right track. This is an example of many, many patients who have a partial, sometimes very significant improvement to a treatment program for Lyme disease, And the problem is, in the traditional approach for Lyme disease treatment, is that officially, if you have Lyme disease, you're cured with 3 weeks of treatment. Well, that doesn't happen. It takes months and months to cure somebody of chronic Lyme disease. And in most cases, we don't really get rid of that spirochete bug. It's just hanging out in the body, kind of hidden from the immune system. And that's another story. But the point is that because we now have this natural strategy that works quite a bit of the time, we don't have exact statistics, it gives patients who have fibromyalgia at least an option. They can try the program. It's totally non-toxic, and it works pretty quickly. Within a month, you'll know whether you're getting better or not. So if you know somebody with fibromyalgia, or you have fibromyalgia, this is an option for you that I encourage you to consider. And if you're interested in that kind of a strategy, just click on the link that's either beside or below this video and explore the program. It's very simple to get a look at the program. It's a few videos inside of a membership site, and it will teach you exactly what you need to do, what you need to purchase to use, and try it for a month or two and see if you feel better. If you feel a lot better, chances are pretty good that you have the same thing that this gentleman has, and it's probably Lyme disease masquerading as fibromyalgia. Now, the context for all the things that I teach is whole person health, health of body, mind, and spirit. And especially with chronic conditions, I find that it is very helpful to be approaching health, trying to bring in all of our resources, physical, emotional, and spiritual resources, because we're dealing with lots of chronic stress at the same time. So if that's you, I do encourage a holistic approach, a whole health person approach to your condition. Hope you found this helpful. God bless and have a great day.